Governments make unprecedented commitments to family planning. We ask how they will deliver on their promises, and a special community report on family planning from Uganda. Good evening and welcome to the White Ribbon Alliance Citizens' Voice. My name is Farhana Ahmad. Today we're reporting from London, where the Gates Foundation and the UK government have convened a global summit to secure commitments that would allow 120 million more women to have access to family planning. A number of governments have stepped up to give their pledges. We spoke with key officials at the summit to find out how these promises will be kept.
We have committed significant resources, over 400 million for each sector program, and we have a very strong family planning program. So when we go back, really, we'll see that those are being implemented properly. We do the annual programmatic reviews that how much we have achieved.
The deliver the commitment is to find the problems in the area that we have said, in the different sectors, in the urban and the rural, and the rich and the poor, and the different quintals in Bangladesh. So we have to approach each problem in a different way.
The role of parliamentarians is very important because, like in our democracy in Malawi, we would want to legislate these commitments that we have set and agreed here.
We will be taking these commitments also and looking at them every year in the report that will go to the Secretary General through the Independent Expert Review Group, making sure that whoever made a commitment actually did what they said they were going to do. If they didn't, why not? Was it lack of will, or was it a proper constraint that perhaps other people who've made commitments can come together to help address?
Let us remember that we need human resources for help, in particular midwives, to deliver on these fabulous commitments.
This is a tremendous, extraordinary opportunity to revitalise an agenda that died 20 years ago. So I am incredibly optimistic that we can get family planning right at the top of the global health agenda.
Contraception is the key to the reduction of maternal deaths and can tackle vital issues such as birth spacing and also unsafe abortion, which accounts for 13% of the maternal deaths worldwide. Here is a special community report from Uganda.
When we visited Kari on Saturday, and I found this cow dying of septic abortion, I knew I had to communicate this to all the young girls who go for family planning. There wouldn't have been that unwanted pregnancy if she was using family planning. Mother doesn't have any money and she's here, induced septic abortion, she's discharging a lot of pus and there isn't any drug. She's 16 and dying of septic abortion.
We are fighting the negative attitude towards family planning. This group, they are trying to help fellow women use family planning.
Bana bameka abali abakozesa family planning mwanike kwa emikono mu group abakabali ku family planning mpegano oli bwetwali tukali kusomesebwa ebyaseebidanazi abakazi balinga bazalanga buli mwaka.
Family planning and reproductive health is really the vaccine for improving maternal health. It's very cost effective. It can be given, you don't need necessarily always to have highly qualified personnel. You can give it at the community level. And so to me, I think we need to bring this to the attention of leaders as well, that they should see family planning as a low-hanging fruit in order for them to tackle maternal health. And I think that is a very important message.
Many recognize the moral and social imperative for providing women with contraception. But what is the economic argument? Research shows that for every $1 invested in family planning, a government can save $6 in public services. Today is a landmark for women's rights. Governments have united to address a key issue in reducing unnecessary maternal deaths. Every one of us can play our part to make sure these commitments are delivered. We want to hear your voice. Join us on Twitter and Facebook.